A very lovely good evening to all of you. This is Dr. Pooja, your original guru of biochemistry. Now, today we are going to discuss a very important, I would say, and a comparative table on water soluble vitamins. As you can see from the table, here everything is there. What is the active form of the vitamin? What are their functions? And what are the deficiency manifestations. So let's see, because this is a very important topic in biochemistry. So first of all, let's see what is B1. We all know that B1 thiamine, which is basically present in the polishings, and the active form of thiamine is TPP, thiamine pyrophosphate, and the major function is that it is required for oxidative decarboxylation, very important, and it is the marker of transketolase enzyme, which is of HMP shunt, and deficiency leads to beriberi, which can be wet beriberi, dry beriberi, infantile beriberi. Coming over to B2, riboflavin, the active forms are FAD and FMN, and it is required, they are required for redox reactions, means oxidation as well as reduction. And the deficiency of riboflavin leads to glossitis is there, chelosis is there, then seborrheic dermatitis is there, right? If we talk about B3, it is the only endogenously synthesized vitamin synthesized from tryptophan. 60 milligram of tryptophan is required to generate 1 milligram of niacin. The active forms are NAD and NADP. And again, just like FAD, we know FAD is converted into FADH2, similarly NADH plus H positive. So, deficiency of this leads to pellagra, which is characterized by 3 Ds, diarrhea, dermatitis and dementia, which leads to the final D, which is death. So basically we can say 4 Ds. Coming over to the next vitamin, B5, which is pantothenic acid. Active form is coenzyme A or acyl carrier protein. And if we talk about the functions, whenever we say coenzyme, be it acetyl-CoA, be it propenyl-CoA, they all are related with fatty acid metabolism. And that is why they are the acyl carriers. And deficiency of pantothenic acid leads to burning feet syndrome. Then it is also known as Gopalan burning feet syndrome. Coming over to B6. B6 is pyridoxine. The active form is PLP, the most important coenzyme for transamination and decarboxylation. And it is required for so many important, coenzyme for so many important reactions, be it transsulfuration and be it is again, I would say coenzyme for this ALA synthase. And deficiency of this, neurological manifestations are there, sideroblastic anemia is also there. Then come over to B7 or biotin, carboxylation ka coenzyme. Okay, and there are basically 3 very important reactions of carboxylation which requires biotin. We all know carboxylation ke liye there is A, B, C, the mnemonic, ATP, biotin and bicarbonate ions. And deficiency, it leads to multiple carboxylase defect, right? Coming over to B9, folic acid, leads to 1 carbon metabolism, and the active form is tetrahydrofolate, and it leads to megaloblastic anemia and spina bifida also. Coming over to B12, cobalamin, if it's like having a central metal surrounded by 4 tetrapyrrole rings. So if it has methyl, it is methyl cobalamin. And there are again so many important reactions catalyzed by B12. One is homocysteine to methionine, and it is a coenzyme for methyl-methyl-malonyl coenzyme A mutase, which converts methylmalonic acid into succinyl coenzyme A, and deficiency leads to megaloblastic anemia and homocystinuria also. Then coming over to vitamin C, rich in citrus fruits, active form is ascorbic acid, it is used as an antioxidant, that is by hydroxylation, and deficiency of this leads to scurvy. So this is a crisp table of all the water soluble vitamins, their functions, their active forms and their deficiency manifestations. So I hope you guys like this video of mine. So guys, subscribe to my channel and keep watching. Stay tuned. Take care. Bye bye.